I'm going to be showing you some cases that are current, meaning that I've seen these patients in the past 3 weeks. They're actually either brand new patients or active patients. I want to just look at the instability of the cervical spine. What are the symptoms of cervical instability? Well, you name it, it's a symptom. So anywhere from obviously neck pain to arm numbness to like headaches, vertigo, dizziness, drop attacks, right? The person just starts passing out for no reason. But if you look at instability of the cervical spine, it leads to loss of function and in severe cases, organ system failure, but also something that we see on a regular basis, leg function failure, meaning that the person's losing leg function because of stability issues in the neck. What sparked this was this story right here. I'll just play it.
I had this chronic back problem which had been with me for years and years. I was in my teens. So I fell from a bike and I fell on my tailbone. I never could sleep at a stretch for more than 3 or 4 hours. Every time that I would turn in the bed, it was so painful. Couldn't even turn my head properly. I was able to sleep for 6 hours at a stretch, and that was like a dream come true. Oh, I can sleep for 6 hours at a stretch. That was the biggest thing. And I'm sleeping better, my digestion is better, my mobility, my posture has improved dramatically. I would recommend this very strongly to all those people who are suffering from pain like I did. They should at least give it a try. I'm sure that each one of us will be able to get some kind of benefit from this therapy.
What I want you to get is like, this is 25 years of pain and suffering since the mid-teens, 25 years of undiagnosis / misdiagnosis. And her being a medical doctor, most likely she was able to access very, very specific, specialists, and still it gets undiagnosed / misdiagnosis for a quarter century. How much money, how much pain and suffering for nothing over a quarter century, right? And so start thinking about that. So Eric came in. So February 15th, actually day after Valentine's Day, February 15th, there was a snowstorm coming into town. We were going to leave because we were going to go see road. So I want to get out of town. And it's like 9:45, and I was hitting the road at 10 o'clock. And 9:45, Eric shows up. He can't move. He's cocked over. Both arms are completely numb and massive headache, and he can't move. So I'm going, okay, well, what am I going to do? So you know what? Let's at least get this efficient. I don't want to have him hang for the next week. That's when I'm going to be back. So what I'm going to do is I'm going to take an X-ray. Took some X-rays, and he's been suffering like this for on and off for 10 to 15 years. Long story short, adjusted him, okay, immediately, okay. I did a seated cervical. He pops off the stool and he starts to walk and he goes, oh my goodness. And he let out a grand old yelp and just started walking. He goes, oh my goodness, it's like a miracle. He's just moving, right? Like one adjustment, okay, one adjustment. He's been suffering for 10 to 15 years, one adjustment. Okay, did his report last week. Now, when you look at this, obviously we know as spinal reconstruction specialists, loss of cervical curve, anterior carriage of the head, 3 inches forward. Punjabi translates to what? Maybe 30 pounds of extra pressure to the 5/6, right? We see the bone remodeling. We actually see the spurring. We can see, the osteophytes or spondylophytes. We can see the, anterior disc wedging. And we know tensile stretch to the spinal cord. We all know this. But what we have to see, okay, is this is not stable, okay? This is not stable. This is unstable. This is only going to get worse. And I told Eric, I said, the only way that this doesn't get worse is if we start getting that red line back to the blue line. Yes, we want to increase the proper mechanics, the segmental motion. Yes, we want to take pressure off the spinal cord. We want to take pressure off the the nerve roots. But we want to bring that red line back to the blue line because it creates more stability within the cervical spine. Right? Glenn comes in last week. Okay, he's 53 years old. He's my age, 53 years old. He can't move. He can hardly get on the table. He's completely immobile. He's bawling. He can't work anymore. He can't move his head. His arms are, are numb. He's got the whole dermatome stuff going on, headaches and stuff like that. And he's just devastated. He says, I saw you guys on social, and I want to come in, and I'm hoping you can help. And I'm going, Glenn, you've had some work before. He goes, yeah, well, I've had the work before that, in the C-spine, we see the spacers there. But understand, these spaces were inserted not after trauma. These spaces were inserted after massive amounts of degeneration causing disc bulging. And after they did the spacing, he said, it helped relieve it a little bit. I've been okay for a little bit, but now I'm losing my legs, right? Now I'm losing my legs. Wanda comes in December 2023. We see the reversal. We know that the reversal will degenerate the fastest, right? Right below the apex of the reversal, we can see the bone remodeling, the disc degeneration. We can see the anterior wedging. We know that that's going to produce disc bulging. She's come in with whole spinal pain, neck pain, headaches, arm numbness, the whole bit. She comes in for a report in early January. She starts care. Within 2 weeks, she's completely like no more symptoms, feeling amazing. And she had been suffering like this for 10 to 15 years and seen chiropractors, seen MDs, seen all the specialists, misdiagnosis or undiagnosed or both, right? Well, she's feeling so great. She sends in her son, Michael. Michael's actually 23 years old, got massive spinal pain, massive low back pain, massive neck pain, and is on work WSIB. He's been going to see a physio 3 times a week for 7 months. He gets 6 adjustments just in his neck. Pain completely gone. But you know what? What we know about these two things is that if we don't reverse that curve back, and if we don't get that red line back, it's going to continue to degenerate, because this is a non-stable, this is unstable system. This is instability. Stephanie comes in January 2020. And just see how fast a reversal can happen, okay? Stephanie, 2020. Well, March 2020, the world goes crazy, right? COVID, I don't see Stephanie until she comes back in October 2023. Now, look how fast, okay, that reversal came into play. Why? Because that first x-ray is not stable. And as of January 2020, it's not stable. It's just going to get worse. Well, she goes through a couple of hits to the head. She's a goalie. She's got, a reversal now. She's got anterior disc wedging, okay? She comes in now with, neck pain that's worse, headaches, migraines, dizziness, right? And she was in yesterday. And because she missed last week, and I said, why'd you miss? Is because now she's passing out of nowhere. She passes out. Well, those drop attacks? She's passing out. They diagnosed her last week with GAD, generalized autonomic dysfunction. I said, oh, meaning that they don't know what's causing it, meaning that they're just saying that there's an imbalance between, the fight or flight and her resting, sympathetic, parasympathetic. They said, yeah, that's exactly what they said, but they don't know what's causing it. Well, you know what? Maybe it's this that's causing it. Instability, right? Not stable. We have to bring that red line back, because if we don't reverse the reversal, it's only going to get worse. This doesn't get better by itself. Shelly, 43 years old. Now, look at how fast degeneration can happen, because sometimes we're thinking in in terms of 5 years, 10 years, 15 years, 20 years down the road. January 2020, Shelly's a biochemist. Look at her. We see it. We can see it. It's obvious to all of us, 5, 6. January 2020, well, COVID hits. She disappears for a couple of years, comes back, and this is what she looks like February 2023. Now, look at that. Look at the spondylophytes. How much more? Okay. Look at the disc degeneration. Look at the bone remodeling. And that is in like literally 3 years. Okay. So that's how urgent this is. And we don't see, do we see what's happening to the, the discs? No, we can assume, right? Do we see the disc going back in the PLL? Do we see ligamentum flavum bulging or starting to bulge? Or do we see that, the cross, the scar tissue formation? We don't see any of that, but we can assume it. And we know because that's what the research shows, right? Now, what we do with reversals, this is what we did with reversals, okay, 50 years ago. This is a fusion that was done 50 years ago. This is Adrian 93, well, 93 now, but she was actually whatever, 88 back then. So 5, 6, 7, you can see the way they fused her. She had a reversal there, okay? She had a reversal, they fused her. Now she's coming in to see me. She says, well, I got neck pain. My arms are going numb. I got headaches, but I'm losing my leg function. She came in, okay? She came in with a walker. Now look at this. This upper part just looks like it wants to eventually just slide right off the bottom part, right? You can just see, like the retro on this too. What can you do, doc? Well, this is her November 2022. Well, it looks better to me. Look, we got a better curve going in the upper neck area. Look, the retro doesn't seem to be there. I know it's better because she's won from walking with the walker, okay, to walking with the cane, and now most of the time she doesn't use anything. She'll use her cane once in a while, only when it gets a little slippery outside. She's still independent, lives by herself, actually lives by herself, drives by herself. And the biggest thing her biggest thing was not the walking, is because she was afraid of losing her arms because she's a big knitter and she knits as a way to give back to others. So like, how important is this, right? Now, this surgical fusion didn't happen because of a trauma. Well, there's a trauma that led to progressive degeneration, and it's a progressive degeneration that led to this spinal fusion. Here's another spinal fusion. Christina, 53, March 2022, coming in with, neck pain, headaches, migraines, drop attacks. If you get her giggling too much, she'll actually, just pass out. So surgical fusion, I actually adjust her, okay? So with Adrian, she's 93, I use an adjusting instrument, but with Christina, I literally adjust her. I do seated cervicals on her, okay? No more neck pain, no more arm numbness, no more headaches, and drop attacks have been reduced. And this is her 1 year later. Okay. Obviously, and I still stimulate down below here, guys, with the adjusting instrument by I do seated cervicals on the upper part. Symptoms are amazing. Drop attacks almost all gone. So that's what you can do. Why? Because this is unstable, even though it's been stabilized in the lower neck area. This is still unstable. So we want to move it towards the stability the best we can, right? This is Jack, 67 years old. He came in January 17. He's a very, very successful businessman. I haven't seen him since January 17 because he's been down south somewhere. He loves playing golf. He comes in, he can hardly move. He's losing leg function, right? And he says, well, I don't think you can help me. That's why I haven't come and see you, because I think, nobody can help me. Well, can I help him? Can I help him? He comes in tomorrow night, okay? Maybe you'll have to wait for another time down the road to find out what I told him, whether I could help him or not. But more importantly, guys, is that the question is that if Jack is sitting in front of you today, tomorrow, next week, next year, what will you tell him? All I know is that I can help him and I will. You guys are specialists, guys. You guys are specialists. Most of the people you guys see will be misdiagnosed or undiagnosed. Just stay to your calling, stay true to what you know. And now I'm going to let the high level stuff be delivered by Pascal.
Thanks, Ed. Great intro, very apropos. Talking about the whole cervical spine being unstable. And I think that is, we could just sum it up. That's the takeaway message in this whole thing, is that structure is what gives us our stability. And when we start to see instability, whether it's intersegmental, whether it's at the spinal level as a whole, what we're trying to do to get that back is to bring the structure back. And you will see, I will show you the research that shows us that we are more stable when we have proper structural alignment of the cervical spine. And so why is it important for us to measure these things? Why am I bringing up this topic of specific ligamentous instabilities? And you also mentioned that word, Ed, it's specialist. If you guys want to be considered specialists, if you want to be at the height of your game and be, you know, respected amongst colleagues and other professionals, that you really know what you're doing with the cervical spine, the spine in general, it's really important for us to understand these things. Furthermore, when you can have these conversations with your patients, when you can present this information to them, whether it's in the report of findings or when you're talking to them, you know, table side when you're adjusting them, all of these things, the more knowledge you have as a doctor, as a professional, you know, the more your patients are also going to have confidence that, wow, this doc knows exactly what they're doing. So it's important to understand that ligamentous instabilities are there. Why? Because you can predict how the spine's going to break down. You can predict some of the symptoms they're going to be having. Is it going to change the course of care that you're going to give them? Yeah, it might change how and where you adjust them, right? If there's a fusion in the cervical spine, well, I'm going to adjust them up top and stimulate them with the arthrostim, like Dr. Ed was saying.